Today, we also heard several reports the Biden administration will soon be recommending booster shots for most Americans 8 months after they've been vaccinated. 10 Tampa Bay's Eric Glasser takes a closer look at what's behind the advisory and why some are questioning its timing.
I'll be first in line.
Al Viviano and a lot of folks around his age were among the first to get vaccinated when the shots first became available. Now likely to follow a recommendation for a third dose at the 8-month mark.
Not just for myself, but for others. I mean, humanitarian reasons, ethical reasons.
I'm immunocompromised because I have asthma and other medical issues, so heck yeah, I want the shot.
It's really kind of more like a third dose of the vaccine.
Dr. Michael Tang with USF Health says studies have shown the vaccines are extremely effective at reducing severe symptoms or death, but data is limited, he says, on how much antibody protection drops off beyond 8 months.
We're focusing on specific populations, immunocompromised, elderly, who we know immune system is not quite as good as it used to be.
There is no shortage of vaccine, more than enough, say public health workers, for everyone who wants a third shot to get one. Still, it raises a medical and ethical dilemma. Should people in the U.S. be getting a third dose of vaccine when billions around the world still haven't been able to access an initial dose?
We need an urgent reversal.
The head of the World Health Organization recently said no, making the argument that as long as the rest of the world is at risk for COVID, variants will continue to emerge, threatening all of us.
At some point, we might actually end up with a variant that can start escaping the immunity that's generated by the vaccines.
So far, the booster recommendation is likely to include those who received the Pfizer and Moderna vaccines. Experts are still working on a schedule for those who got the J&J shot.
It's a personal decision, but I want to protect myself as much as I can.
And if we do this all together, we will conquer the virus.
Public health